Hello there, you're watching The Probe on the Joy News channel. Well, tonight on The Probe, there's a loud cry of babies across the country. It's very usual to find these toddlers crying at all times, except that this time round, the reason for their pain is as a result of that imminent danger they face. For days now, lactating mothers in the country have had a difficult time accessing essential vaccines required for these underage persons due to what is being described as a shortage of baby vaccines in almost all public hospitals across the country. The situation is already negatively affecting the health sector as the Ghana Health Service has recorded its first 50 cases of measles, a condition which could have been prevented if the vaccines were available. So tonight we hear the chilling accounts of health experts who are on the grounds and are warning that the situation may become worse if resources are not made available to provide vaccines for the babies. So how dire is the situation, and what could we be doing to solve that challenge, and what could become a nightmare for the health sector? That's on The Probe for tonight. We're live on the Joy News channel, Joy 99.7 FM. It's on myjoyonline.com as well, and all of our social media platforms. You can be a part of The Probe. Don't forget that we'll return by introducing my guest and telling you how dire the situation is. This is The Probe. I am Blessed Sogan, and you're welcome. Please stay.
After a month, nursing mother Florence Kwabla is back to the vaccination center at the Adabraka Polyclinic with her baby girl, Gladys. Florence is here to get Gladys' weight checked and her vaccination shot. She recorded a healthy weight. However, the oral polio vaccine due her is still not available for her baby. The last time she was here, she was told it was finished.
With the polio worries me a lot because the first day we came, they said there's a shortage. Then 1 month time we came, they said there's a shortage. So I asked them, is there any available at any? But they said there's still shortage at some of the polyclinics and hospitals.
Another worried mother is Gifty Odonko. Her 4-month-old baby Inshira has also not received the polio and the rotavirus vaccines. She wants government to quickly restock.
I'm told
there is no polio vaccine, so we'd have to return without the shot. It could expose her to diseases. I hope we can get it at the pharmacy to protect her.
Parliament's Health Committee took a strong stand to deal with shortages across the country. Committee Chair Dr. Efriye Ayu agrees that no child should be exempt from vaccination.
We are concerned because every life matters. And just as many of us here feel our sustainability has more been because of the vaccines we had at childbirth. We cannot deprive any Ghanaian that opportunity to live. And the absence of vaccines in the committee's thinking is inexcusable or unpardonable.
Well, the Ghana Health Service Director, Dr. Patrick Kumar Bwaji, has assured stores will be replenished in 2 weeks.
Well, so that's the situation in our public health facilities across the country as we speak. Joining me now to have a discussion, we have Dr. Hilda Mantebia Boy. She's the president-elect for the Pediatric Society of Ghana. Dr. David Tinkran-Chum is the General Secretary for the Ghana Registered Nurses and Midwives Association. We also have joining us via Zoom Dr. Hadi Mohammed Abdullahi. He is the Secretary General for the Islamic Medical Association of Ghana, and Dr. Thomas Anaba is the Executive Director of the Africa Center for Health Policy Research and Analysis. Well, so welcome to you, gentlemen and lady in the studio with us. Doc, you're welcome. Quite a very unfortunate situation we have going on there in our public facilities. The Ghana Health Service reporting at the last count that we had about 50 cases of measles. But in your statement, you point out that the situation could even be worse. So what are we learning about this new crisis that's happening in the health sector?
Okay. Hello. Good evening to all your lovely viewers, and thank you for having us to discuss this very important topic. Now, in the northern region, we have, at the last count, we have more than 100 children who we suspect have measles, and it is very worrying to us. This is something that is ongoing, so data is still being collected. And because of the shortage of the vaccines, we expect that there are likely to be many more children affected by this. So the infection is likely to rise as the days go by.
Is this a situation that's unique to the public hospitals, or perhaps it's the entire health system that we're talking about here?
We believe it's the entire health system, and some places are affected more than others, but generally there are shortages of vaccines, and these have been reported from both the private and the public sector.
And what we want to do is to carry our listeners along. For those who may not understand the technicalities of it, we've been talking about baby vaccines. There are those who are wondering what's the essence, even in the first place, and what's required for the baby to ensure their efficient development as a toddler. Talking about these technical processes, just break it down for the average viewer or listener out there. What's required for the baby at this stage in terms of the vaccines?
All right, so babies are babies, and they are born with an immature immune system, if I may put it that way. So their bodies are not strong enough to fight the infections that are in the world or in the environment, and therefore we will need to introduce some of these vaccines. And in some cases, these are the same germs that will cause the illness, but their strength or their potency has been reduced a bit so that their bodies can mount a response to them, thereby helping them to be stronger and will protect them when they actually come into contact with the real infections in life. And so that is really what immunization is about. And there are a number of illnesses that we vaccinate against in Ghana. We have the polio, the tuberculosis, so the BCG is given for tuberculosis. Then we have the diphtheria, pertussis, and then we have rotavirus, we have tetanus, we have measles, yellow fever. All these are infections or diseases that we vaccinate our children against.
I'm counting about 5. Do you have a standard for it?
Yes, we actually do have a standard for it, and I have
you can share that with us.
Yes,
probably
yes. So this is the book that mothers are giving.
Okay.
So I'll just block the name out because there's somebody's name on it. So this is a maternal child health record book. The mother's information is in there, and the baby's information is also there as well. And it actually has a lot of good information for everybody.
Okay. So might need that.
Yeah, yes. So we have this page which is for immunization and vitamin A supplementation. And if you have it at home, you can also go through at birth. Okay. Children will get the BCG, which is for tuberculosis. Okay. They will get the oral polio vaccine, virus vaccine, 0. They'll get the hepatitis B. This is not really available, so that's not giving. But at 6 weeks, they'll get the polio again. Then they'll get the DPT, which is diphtheria, pertussis. They'll get, and then the tetanus, and then Hep B, and then Haemophilus influenza 1, so pneumococcal rotavirus. 10 weeks, they'll get another set of vaccines. 14 weeks, they'll get another set. 9 months, they'll get the measles, rubella, and yellow fever. And then at 18 months, they'll get the measles, rubella, meningitis A. as well.
Okay.
So essentially, this is...
So this strictly has to follow the timelines.
Yes. So, I mean, these are all... They follow a scientific, so the best practice is they should be given at these times so that the body can respond adequately to protect the child. So that is the schedule that we have here.
So what happens if a parent, for instance, misses this timeline that we're dealing with? What are the implications on the baby?
All right. So some is better than nothing. So assuming that you have some of it, but you don't have all of it, right. What it means is that you will not have the required protection that we would have loved for you to get, but some of it is better than nothing. And if so, when it becomes available, in many cases, they are given. But if you don't have at all, what it means is that you are not protected. And if you are not protected, it means that you can easily catch any of these infections. And you see, we are really also very concerned because an illness like measles, my whole time in medical school, I didn't see a child with measles. And for many people who finished medical school, let's say 20, 25 years ago, measles wasn't there. But now we are seeing measles come back, which sort of says that we have gone back on all the successes that we sort of chalked, because these are not illnesses that we would want to see, and that is why it is worrying. And being an infectious disease means that it can infect other people. And if you have people who, let's say their immune system is reduced, people with cancer, the extremes of age, so the very young, the very old, pregnant women, people on treatment that will suppress their immune system, all these people are vulnerable and can easily catch some of these infections and become unwell, meaning that we're going to lose productive time, and some of them may die. You may have disability as a result of some of these illnesses, and that is why we are really we did not want to see something like this in 2023, but we are seeing it. So what can we do now?
And indeed, we need to take action, because if already we are learning of about 90 cases,
over
just
100.
Over 100,
Over
right?
100.
Just in the northern parts of this country. Nobody knows what's happening in the south and other parts as well. And that's why I want to bring in Dr. David Tinkranchum, because Doc, your association is equally concerned about what's happening within the health system, but it appears you're helpless. How are you managing in these tough times?
Well, good evening, my brother, and good evening to my colleagues on the call and the doctor in the studios, and your viewers as well. I think it's not a pleasant situation, as has been elucidated by the doctor in the studios. These are preventable illness that we need the vaccines to fight. So it sort of renders the children vulnerable. And they are in a position to acquire these preventable illnesses. But we need to situate the conversation in its right context.
Okay.
The Ministry of Health is responsible of procuring vaccines for the implementing agencies. So, for instance, Ghana Health Service responsibility is to distribute the vaccines. So we need to place the blame at the right place. We think that the ministry must do what is necessary to procure the vaccines. We have about 10 main vaccines. 7 of them are available. 3, I'm told, are what is in short supply. I think measles, BCG, and polio. And some of them are supposed to be given at birth. So it's quite an unfortunate situation. We shouldn't have been here. And we need to take steps to rectify this anomaly. It's not something that should be mentioned at this time. Like what Doctor was saying, we managed to virtually eradicate some of these childhood illnesses like measles and the rest of it. But it's now rearing its ugly head. So I think that the ministry should do everything possible to get us the vaccine so that the nurses can administer them. We are at the user end, and our responsibility is to administer the vaccines, but if they are not available, we are helpless. There is nothing that we can do.
Okay, for now, what directives are you giving, for instance, to your members as to how they could handle these cases? For instance, if a parent walks in with that child and there are no vaccines, what do you tell the person? And how do you handle such a case?
Well, I think what our members should do is that they should just assure them and tell them the truth. The vaccines that are available that can be given at birth can be given to them, all right? And then they explain to them that they don't have the vaccine. It's not the responsibility of a nurse to procure vaccines. It's the responsibility of the Ministry of Health, not even the implementing agencies, not even Ghana Health Service, the responsibility to procure vaccines. It's the responsibility of the Ministry of Health to procure the vaccines. So as far as our people are concerned, they don't have any problem at all. The only thing is that it's quite disheartening when you are sort of disabled to provide the kind of services that you have been trained to provide by virtue of the fact that the vaccines are simply not available. So all what our people should do is that when the mothers come, they should just reassure them and tell them that these and these vaccines are not available and it's not their making. So as and when they are available and the time has not elapsed, they can provide it.
But scientifically speaking, could we not explore, say, an alternative? Don't we have an alternative in this case?
You know, I mean, if polio is supposed to be given at birth and it's not there, what do you do? There can't be any alternative. I mean, like what doctor said, there are a scientific process, there are timelines within which certain vaccines ought to be given. Okay, it's not like we can just improvise. This is not some of the things that we can improvise. There are so many things that nurses and midwives are able to improvise, including doctors. But vaccines cannot be improvised. You get a point. You need to have them as at when they are needed and administer them accordingly in the right dosages. So I think that we are in a very precarious situation that we need to quickly remedy. And I think the ministry can do something about it.
Okay, there's a question for you and Dr. Hilda, because your associations are very much interested in the development of the child. I mean, why didn't you report this or sound the alarm bell and try to draw the attention of the authorities just to prevent this case before it went out of hand?
Nurses cannot be blamed for this. I mean, there is stock taking. Okay, if you go to the end users, for instance, the community health nurses who administer these vaccines, they take stock and they will report accordingly as at when the stock run out. They will not even sit down for the stocks to run out because, for instance, if you have 1,000 vaccines and it has gone down to 200, certainly you report to your immediate supervisor. So the responsibility cannot be laid at the doorstep of nurses and midwives. I'm sure they did what is necessary. I have spoken to few colleagues of mine, especially those public health nurses and community health nurses at the various centers of immunization, and they did the right thing. So no nurse can be held accountable as far as this is concerned. They did whatever was necessary. They reported the stocks as they were dwindling, just that a decision was not taken. That's all.
Dr. Hilda?
So I just want to say that, yes, I mean, there were reports of a few one-offs, but then if other facilities have it, then people just go there. So it wasn't anything major until suddenly we realized that it was widespread. And that is when people also started having the infections and all. And so we had to also come out.
So you intentionally didn't inform the authorities?
No.
Okay.
So if we are looking at responsibility, whose job it is to ensure that there are no shortages of vaccines, right. The Ministry of Health, like you mentioned, I mean, that is, they have that oversight. The government, they have that oversight, okay? So they have to, they work with the EPI, they work with all the relevant bodies, and they work with the various facilities as well to ensure that we have stock. I dare say that it's somebody's job to ensure that we do not get to this point where people are recording shortages, because we've been running this for many years in this country. And if somehow every time we have had vaccines, how come this time we don't have vaccines or there are shortages? I mean, you can't tell me that we couldn't predict that exchange rates was becoming a problem, that funds was becoming a problem. And generally all over the country now, we know that all over the world there are hardships, but we are saying that the children should be prioritized. And whoever is supposed to ensure that budgeting for vaccines is done, the monetary allocation is there, should do their job and make sure that they are there. Because already we have an issue with malnutrition because of the hardships, the current hardships. How much is an egg today? How much is meat today, a pound of meat? fish. I mean, how are people going to, and all these, you see, when your immune system goes down, then you are more likely to have infections. And so we as a society are already worried about malnutrition and all those other social problems that are developing as a result of the hardship. Right. And this vaccine issue is only going to compound things, because you have children who have some background malnutrition, their immune systems are already down, and they are not getting the vaccines that they need to help them to even prevent them from getting the infection. So we are heading into a dangerous zone. We are talking now, and we'll be talking more and more.
Okay, so here's what I want to do, because there's Dr. Hadi also with us, and there's Dr. Thomas Anaba. Let me start off with you, Dr. Thomas Anaba, because your case is interesting. You practice up north in a private facility, but you also have that public experience because you've managed a public facility before. First of all, tell us about what you're gathering up north, and also run us through the process of procurement, because it's come up strongly. The Ghana Health Service says, well, we're not the ones responsible for doing the procurement. It's from the ministerial level. So just deal with those two issues for us. Dr. Anaba, kindly unmute. Yes, okay, I can hear you now. Yes.
Thank you very much for having me, and good evening to my co-panelists and the viewers. As you said, up here in the north, we are battling with serious cases of measles. I can tell you on authority that I have recorded 2 cases in my hospital who are elderly people, one about 35 years and the other one was around 25 years, meaning that it goes with what we know about measles, that you can get it before 5 years, serious symptoms, you can get it above 20 years, serious symptoms. And they got very serious symptoms that luckily they have been saved. And other hospitals have equally recorded such cases, and we know of the 80-something cases in northern Ghana that is hovering around. And we think that the infection is still ongoing, just that we have to alert doctors to have a high sense of suspicion on patients who come in with symptoms that are not that very common, especially the measles, the whooping cough, and then the rest. As for polio, we can't have any records now about polio because it will take time to manifest. But coming to your second question about procurement, I think everybody in Ghana knows that, in the world knows that procurement of vaccine is limited only to government institutions like the Ministry of Health. It is the duty of the Ministry of Health to do its study, to know the population growth, know how many children are born in a year, how many children are up to 5 years, how many children are up less than 5 years, to know when each child is going to get the vaccines. Then they can program to procure the vaccines down before it is time for the vaccination. So I think the duty lies on the minister to know that this is happening. They have storage facilities that stock all these vaccines. Once you give the last dose or the minimum levels have reached its point, you have to trigger the process of already getting the goods coming into the country. You don't wait for it to get to the red line before you import. You don't also wait for vaccine to get shot before you start complaining. So I think that procurement is basically the duty of the minister, as said by the one who spoke before me. The minister must make sure he gets the money. Wherever you get it, he should. But I would say that we are fond of making so many mistakes when it comes to procurement in the ministry, especially vaccine. We made those mistakes when it comes to procurement of coronavirus medication. Now we are making the same mistake for a program vaccination that is worldwide understood, that if you have these vaccines, this illness will not be manifested in your country. I don't see why a well-elaborated program for vaccination, which is not done by Ghanaians, it's done by the whole world, it's structured by the whole world, that Ghana should fail in implementing it simply because we do not have money. Where has the money gone to? Why don't we know that?
Why are we not blaming, for instance, the administrators of, for instance, our public hospitals? Dr. Hilda, of course, says, well, it's not their fault. We've heard from Dr. Tinkran Chumi says, well, just lay the blame squarely at the doorsteps of the ministry. But how about the managers, those who manage the facilities as well?
Blessed, 3 months ago, I tell you, around September, October, we raised alarms of shortage of vaccine in Ghana. You can go to the newspapers, you find it. They came out, the director of public health of the Ghana Health Service came out to tell us that in 2 weeks we'll have all the vaccines in Ghana. So not that they've not reported. There's not even need reporting. They have a stock level in the ministry, and they know how it goes. Every region has a stock level. The ministry has a stock level at the medical stores. Once they see that the stock level is getting to critical levels, they know the birth rate in Ghana. They know the children under 5 in Ghana. So once the stock level is getting down, they must procure it. But it is a quarterly procurement. Once it is a quarterly procurement, I don't see why they should fail. It is something that is standard. It's like our salaries. It's like salaries of workers. Government have to plan to get the money ahead before they pay the money reaches. So if the government fails in providing the money, whether exchange rate has increased or decreased or whatever, it is the business of government to find the money. And we have the money. Let me tell you, COVID-19 gave us $10 billion excess. A 10 billion Ghana cedis excess. Where is that money? Couldn't they use that one to buy the vaccines? Didn't the minister pay for vaccine that wasn't existing? Now we have vaccines that are existing, and you are saying there's no money. That is why we are putting the blame on the government. Administrators in hospitals, you know very well how they are appointed. They are appointed politically sometimes, that they fear to raise alarms or else you lose your job. That is the situation in Ghana. And we all know it. We have to stop it. But I tell you, they are aware that the vaccine was getting short. Just that they were adamant in buying, thinking that they could use the money, misappropriate the monies, and do what they want. I for sure think that it is not because of exchange rate. This should have been planned a year ago. The last year budgeted vaccines up to this year. I don't think that they will not budget up to this year. Okay. They always budget it in a way that it covers. When they read the budget in last year, it had the money for procuring vaccines for this year. Where is that money?
Well, interesting questions you're asking there. But I can just imagine how the situation would be like for those who are within the inner cities as well. Dr. Hadi, I'm sure that your group has been thinking about that. Dr. Hadi, if you're with us, I was just asking, I mean, your group as well, you're concerned about this. I'm particularly worried about those in the inner cities, deprived communities as well. How would they be coping by now?
Yeah, I mean, I've heard several. Good evening, actually. Good evening to Dr. Anna. Good evening to Hilda, and then my good friend from the GRN. Our people have really been concerned about this, and I've heard several stories where some of the mothers actually have visited these centers and they didn't get the immunization. We have to also contextualize it where we are. We are surrounded by several countries, especially in West Africa, our neighbors. There is an aspect of propaganda which has been going on when it comes to Muslims, and that is why diseases like polio are still endemic in the northern part of Nigeria. And we are also worried by the fact that if you look at situations in Burkina Faso and then Mali, where we're beginning to get influx of refugees from those countries into and we know that the acceptance level of vaccines in that part of West Africa has been quite a challenge. Right. And then also, as a neurosurgeon, I can tell you that some of the effects, the long-term effect, the complications of this infection will eventually comes to us. And we are very worried. If you take measles, for example, measles can lead to brain damage in our children. Apart from that, as Hilda spoke about, pregnant women can also get these diseases. Once their immune system is down and we have an outbreak of it, she can get it. And we know children can be born with central nervous system disorder, or to put it in layman's, brain damage or spinal cord damage with all kinds of malformation. So I think that every step must be taken to make sure that these vaccines are available. For me, I have said that, look, if there is anything to sacrifice my salary for, it will be vaccination. Because I completed medical school about 18 years ago. And during my training, I did not see measles. And throughout my 18 years of practice, I didn't see measles. And I can tell you, I can't identify measles when I see one. You know, and we've come too far, to kind of embarrass ourselves. The first time I heard about this was on Voice of America, and it's very embarrassing. And I think that people need to own up and be responsible. This shouldn't be happening to Ghana. You see, and we should all be concerned about this attitude from those who need to provide us with this vaccine. I know that by 2028, the Gavi Foundation funding of some of these vaccines will be taken off for some countries, which Ghana falls within, like those low middle income countries. And if by 2023 we are beginning to cite funding as a problem, because the Gavi Foundation gives us almost close to $40 million for this vaccine. So if the foundation by 2028 takes away that funding, how are we sure? If 5 years even before that we are struggling and we are citing no funding as an issue, then we are really in deep trouble. And that is why I stand the Pediatric Society of Ghana's call that we must begin to have a ring-fence funds. And make sure that our babies get this vaccine.
Right, and let me just hold you right there, because that's the next phase of our conversation, the solutions. I would explore that with all of you, take your thoughts on this. But for those of you who are with us on radio and here on TV, this is The Probe. We'll be back shortly.
Score HD, the new exciting football channel, is now available only on HD Plus and brings you football from around the world. Watch Sadio Mane and Daniel Kufitre in the top weekly match of the Bundesliga 1 and DFB Cup, Primera Liga, Copa de la Liga Profesional, see Ronaldo in the Saudi Pro League, as well as daily sports news every other hour. Also, get updated on Messi and Mbappe on PSG TV and many more. Feely on HD Plus channel 151. Agronaede, HD Plus, the Feely experience.
And thanks for staying with us here on The Probe. It's live on the Joy News channel, also on Joy 99.7 FM, and of course all of our social media handles. We're talking about the shortage of baby vaccines. By now, if you haven't heard already, there's an outbreak of measles, which could have been prevented if we had these vaccines in place. And of course, as many as over 90 cases recorded in the northern parts of the country already. We've been hearing from our experts here, helping us with that discussion, but I want us to move into the next phase of the conversation, which has got to do with the solution. How do we find an immediate solution to the problem? And Dr. Hilda, that's where I want us to start off from. Your group is proposing sort of a ring fence, that's how you call it,
yes,
a ring fence solution to this whole vaccination process. Explain the mechanism to us and how it will work if our authorities take this seriously.
All right, so essentially it means that we are looking at it in a way that there's funding for it, so we budget or we set money aside for it, and that money is protected, so it's sort of fenced. There's a fence around it. Right. You don't touch it under any circumstances. If you are looking for money from
the past or the
well, so when I shared the ad, you know what? There were people who were asking, where is EPI? Where is Ministry of Health representatives? Where are the government officials who are supposed to be answering to this? So they take a large responsibility for this because they are really responsible for ensuring that we have the vaccines. We are stakeholders, and as Pediatric Society of Ghana, the children are our priority, and we are their chief advocate, so we'll continue to talk.
But if someone is asking that question, I guess the solution or the answer is very simple. The fact that, of course, Parliament this week tried to, of course, get the Minister responsible for health. He did not appear. Our indication is that may happen in this coming week. So that's what we're hoping for. But no comments, no statements as of now. So just to clear that out of the way. That's why we're not hearing from them. We don't know officially what's accounting for this. It's just a case that are reported. Matters are pointing to the depreciation and other unofficial causes. But we haven't heard from the minister.
Yeah, so we are all waiting to hear from them. But at the same time, we know what we need. What we need are the vaccines. And we can talk, but it's action that we are looking for. So whatever it will take for them to get us the vaccines like today or like yesterday, we need the vaccines, because every day we risk having children die from these shortages. We risk them developing disabilities. We risk these infections infecting the elderly, the other people who are also vulnerable. So
how much time do we have?
How much time do we have? So I think we have all heard, or we're all told that within about 2 weeks or so the vaccines will come in. I think a week has gone already, a little more than a week has gone already. So we are hoping that this week we should see vaccines, but you and I can hope. We can do as much as we can to put pressure on the government and the powers that be, whoever is responsible, to do the right thing and to get the vaccines for our children. Going forward, we all know, like we have done in the past, that the children need the vaccines, and it takes a lot of effort to even get to the point where people accept the vaccines and believe or know that it will be good for their children. So if we have gotten to this point, let's not go back. Let's ensure that we do not have any more shortages. This is like going back. And it's an embarrassment.
In a long time?
It hasn't happened in a long time. Occasionally you may hear one or two, but within a very short period, the vaccines are there. So we don't want to see that. Mode of spread,
of these kinds of diseases that we're recording, for instance, measles.
Yes.
And you're pointing to the fact that it could be transferred.
Yes. So respiratory,
to anyone at all?
To anyone. You see, so if you have had the vaccines, what it means is that you are less likely to get the infection than somebody who has not had the vaccine, especially if your immune system is working well. You are not on any drugs that will suppress or bring down the function of your immune system. Then you are less likely to get the infection. And even if you get it, you are likely to get a milder form compared to somebody who hasn't been vaccinated. And that is why it's really important. The BCG vaccine, which is for tuberculosis, for example, when we give the BCG vaccine, it doesn't prevent the children from getting tuberculosis at all. It just prevents them from getting like very severe forms or forms that spread. So let's say to the brain, to the bones, it prevents them from getting such kinds of tuberculosis. So it's really about protection, and it's like maximal protection in some cases and very good protection to prevent totally in other cases.
Okay, let me bring in Dr. Tinkranchum, because there's this aspect that we're not looking at, and it may be my suggestion, just correct me if I'm wrong, the point about whether or not the supply of the vaccine itself is not dependent on any other factor. I'm asking the question because of what happened, for instance, during the COVID period. The Auditor General reporting that, some funds were made available to an international organization for the supply of COVID-19 vaccines. We couldn't find the vaccines. So in this case, what's your diagnosis of the problem? Is it the money aspect of it or the technology, quote and unquote, aspect of it?
Well, we have been told that there is money. This is our program vaccines. Okay, it is not like the COVID-19, which was a novelty and we were struggling to get vaccines.
Okay.
These vaccines are really on the market. I think the problem has to do with liquidity. Okay, and as urgent as it is, we need to stop everything and prioritize the life of the children because they are so vulnerable. Okay, so my solution is that government should just prioritize the life of these vulnerable children, provide whatever resources that is needed to procure them. But the vaccines are available on the market. Okay, to answer your question,
and the supply is not dependent on any other agency.
Well, I don't think that, and as I've said, these things have been there for a very long time. Right. Okay, unlike the COVID-19 vaccine that we had to go through certain agencies and even through middlemen to be able to procure them and the rest of it. There are already established systems or channels of procurement when it comes to these programmed vaccines. Okay, we've been doing this for a very long time. So it is not premised on anything that will sort of impede, if you like, the availability of the vaccines. So what government should do is prioritize. But what Doctor just suggested is brilliant, and I like the advocacy. And what we need to know is that
the fact that you mean the fact that we don't have to touch the funding for it.
Exactly.
Is it that you, the health association, suspect that something is untoward is happening, and that there's a temptation by some unseen hands to dip their hands into that coffers?
No, not necessarily. You know, like what Dr. the neurosurgeon said. We have been supported over the years, but the fact that we have attained lower medium income status tells you that some of the funding sources are going to dwindle. All right. So if this Gavi concept is dwindled, then we need to own the thing as a country. So that is where the suggestion being propounded by the doctor in your studio comes in handy, where a specific amount of money can be designated for the purposes of procurement of programmed vaccines for immunization. Such that we know that this particular amount of money is just for this purpose. And that's where we need to inch towards, because a time will come that we may not get the supply as we are getting right now and the support that we are getting right now. So basically that is what we need to do. And I think we need to stop everything that we are doing as a country and direct the money to the procurement of the vaccines for now. Because you see, it has repercussions. What we are seeing right now, it can lead to dire consequences. And the earlier we arrest it, the better for all of us.
I was just about to find out if the vaccines we're talking about are covered by the National Health Insurance Scheme, because NHIS is indicating that they've released some amount of money on that. How does it augment the processes to try and get the drugs?
What I'm trying to say is that those program vaccines are free of charge, and I don't think that it's premised on the fact that one will have to be insured before you can have it. I think it's for free. And I remember those days that some of us were participating in polio immunization and the rest of it. We were moving here and there, distributing the vaccine. So, well, if health insurance wants to support, because the problem is about liquidity. So if health insurance has money and they want to give some to government to procure the vaccines, they're better for it. All right. But I don't think that national health insurance, whether they are here or not here, should impede the procurement process. Whereas our government should just give us money to go and buy the vaccines so that Ghana Health Service can distribute the vaccines accordingly, as they've been doing all the time. This is a very simple thing. So the minister should be ready to provide whatever resources that is needed.
At least we've not heard from the minister. We don't know why he's hesitating to speak. But from the perspective of the JRNNA, your group, what's your appeal to the minister, by the way?
Well, our appeal to the minister is very simple. We think that we have been trained as professionals to administer these vaccines. And we cannot just go and sit down there. Mothers will come with their vulnerable children and we'll be looking at their faces. So, as an association, we are pleading with the minister to get us the vaccine so that we can work with it. All right, I would have directed the issue to Ghana Health Service, but of course, I know the procurement processes. I know that Ghana Health Service is handicapped when it comes to this. And that's why the Director of Public Health said that the vaccines were going to come in 2 weeks. Of course, he can only say something like that based on the promise that the minister or the ministry has given. All right. And if the ministry does not go strictly by the timetable that they set for themselves, then it will certainly affect the distribution. All what they need to do, or what they are supposed to do, is to just get the vaccines and distribute. So if the one who is supposed to provide the vaccines is refusing to do the needful, then it will certainly affect the distribution as well.
Okay.
So the minister, I'm sure perhaps he is working. He's supposed to be working, and I believe he's working to get us the vaccines.
Dr. Hilda, you support calls that, well, let's not make this free. Allow people to pay for it, and that will ensure the constant supply of the vaccines. Do you side with those who are making such calls?
No, not at all. Never. Because this is a public health intervention. Somebody's illness can infect you, and you could have your money, but you could die. And many children come from homes where there's not enough money. We know we have NHIS, but even that we have problems. And we are even hoping that children under 5 years of age will have health care for free. Please don't think of asking people to pay for vaccines, because it will be a public health disaster. As it stands, even with this shortage, look at what we are seeing. How much more if we go to a point where we have the vaccines, but people are not able to afford it? This, please, nobody should talk about.
So it's a no-go area for in terms
yes,
of the
it's a no-go area. I do not think that children should be asked to pay for vaccines. No, not at all. It's the least that the government can do for its future. Protect your children. How hard is that?
Okay. Dr. Thomas Anaba, the commitments internationally that we've made as a country, of course, the Under 5 policy, also which is flowing from the SDGs that we have signed on as a nation to. Do you feel that that's increasingly becoming under threat, given what's happening in terms of this shortage of these vaccines?
Thank you. Yeah, I think, yes, it's becoming a threat to the SDGs because we are not complying with preventing preventable diseases that are highly contagious. We may spread it in Ghana and take it across to other countries. You remember very well, the president said we are going to be a nation without using AIDS, Ghana beyond AIDS. And now they are cutting the AIDS and it is affecting it. Quite apart from that, we are still getting funding for vaccinations. I don't know why we can't keep that money for such programs, and that money should get short. And we are not getting the money in cedis. We are getting those monies in dollars. So I don't see where the exchange rate matter should come in. Quite apart from that, if we think we as a country cannot get money enough to buy vaccine for our children, our generations to come, I don't see why we should have money dedicated for projects that are not fundamentally important, like building a cathedral. I don't even see why we should celebrate independence if we don't have vaccine for our children. I think we should use that money. I've seen other countries use money for independence to do communal labor, cleaning of all the communities. Why can't the government say, look, we don't have money for vaccines for our children, let's cancel Independence Day celebration, I'll make the money that is there, procure the dollars, and buy vaccines. We have programs going in this country that are not very, very essential.
Dr. Anaba, would this not be far-fetched?
It's not far-fetched, please. Will we be happy in future if we don't have a generation to take over from us? Do you know what will happen to a child who gets polio today? In 10 years' time, 20 years' time, you'll be a disabled, probably on the street begging, increasing the burden on the streets, increasing burden on those who will be capable. We will have children who will have brain damage, who will be vegetables lying in their homes if they get measles. Will we be proud of that? It's not far-fetched. Independence Day celebration is to celebrate achievements. We've achieved that already, but we are going backwards. So we have to use the little money we have to rather cushion those who are very vulnerable, and nobody will say no. Which family would be unhappy if the father sacrifices to buy a car or celebrate his birthday and use the money to buy medicine for a child? No one will be angry with his father because of that. We won't be angry with President Akufo-Addo if he sacrifices Independence Day money, celebration money, to buy vaccines for children. I'm coming from Garu right now, and I saw children marching They are spending money on so many things.
And now a small business setback, delivered by a kind French stranger.
Monsieur, there was an accident. The windshield of your catering van is, how do you say, kaput? But Progressive has an extensive network of repair shops. Now, we sing about the old days. Brave marin revient de guerre.
When things go wrong with your small business, it's comforting to know you have Progressive Commercial. Get a quote in as little as 6 minutes at progressivecommercial.com.
Croissance for everyone.
Progressive Casualty Insurance Company and affiliates. Covered subject to policy terms and conditions.
Cities with cars burning fuel. Meanwhile, the very children in the homes are not going to get vaccines and are going to fall sick. And this is not a disease that is difficult to get. It's easily transmissible by touch, by cough, by even water, contaminated water. And we know many of our homes in Ghana don't get very clean water. And you can easily get polio if you are not lucky. So I think that the money is there. It's just that they have misappropriated it. And it pains some of them that a minister who has been misappropriating and mismanaging the health sector is still at post and refusing even to come to parliament to answer questions about children who are vulnerable, who are at risk of dying because of vaccines that he has not procured. I think that something drastic must be done to the ministry, but government must look for the money to buy the vaccines quickly. If it is meant to cancel their trips, they should cancel it. After all the trips they've done have not yielded any results. We are being classified as junk when it comes to IMF and all those things. So let's rather protect our children so that they can be able to come and pay the loans that we are collecting. These are the children who are coming to pay for the loans we are collecting today. And we want them to fall sick. Who will then pay for it? So please, I think that closing Independence Day celebration and buying vaccines is nothing so much to ask for.
Dr. Hadi, the point about international organizations and how they could be of help at this moment, we know that UNICEF really goes into such projects. There's also other international organizations that could be of help as of now. Should we consider applying to some of these agencies to at least help us in the interim? Dr. Hadi, you'd have to unmute. If you can hear me, I'm just talking about the international organizations. Yes.
Yes, I heard you. Yeah, I mean, look, we already have support from these organizations. You know, it is part of our funding that sometimes government will not talk about. We all know. I mean, for example, I mentioned the Gavi Foundation. They've been supporting us. It was less than $40 million. Okay. $40 million. UNICEF has been supporting these programs. Hello?
Yeah, you mean $40 million, you say?
Yes, so, yes, about $40 million. Okay, and from all information that I have, the purchase of these vaccines actually predates, or it's usually given in the preceding year. So the vaccine funding for this year was already budgeted in 2022, you know, and I have been told that the NHIS had gone to Parliament to say that they had released the fund, and from all indication they released the funds up to December. So where is the money? Where is the money? Where is the money that the Gavi Foundation gave us? Where is the money that the National Health Insurance Service give to government? This is the responsibility of the Ghanaian government. So if you have institutions or quasi-government institutions as NHIS and then international private institutions like the Gavi Foundation and UNICEF supporting us, so where is the money? That is what we should be asking our government, you know. And for me, until the vaccines are ready, I think the media should not discuss any political matter. We shouldn't give the politicians any space to come and even discuss their aspirations. This should be the center issue in this country that every media house should be discussing. You know, I think that yes, initially we were trying to also look at the role that the healthcare workers played in some of these delays. But I think the media has also been part of this. Yeah, because as I told you, the first place that I heard about this issue was on Voice of America. Meanwhile, the Pediatric Society of Ghana had released their statement as far back as 22nd of February. It's almost 2 weeks. Why aren't we discussing? Probably because, yes, we can forgive you because you are not healthcare workers. But look, the issue of vaccination for babies is serious. And if you want to have an idea of what it is, just look at the world before we had the COVID vaccines.
All right.
Look at how the world was. Look at how many economies run. And this is what we are doing to our children. You know, and what I fear most are even the endemic diseases that we are still fighting, like tuberculosis. Tuberculosis is with us in Ghana here. As for measles, I even said I thought it was remote because I have never seen one before. But just when we miss the timelines, we are beginning to get them in our system.
Right.
But TB is here. So please, and I'm ready. This is a promise I'm making to Ghanaians. I'm ready to do a one-man demonstration. It's something, I'm a very shy person. It's something that I've never thought of doing. But look, we must not fail our children. We must not fail them.
Interesting point you're raising.
It's not fair.
And I'm grateful. But I just need to state that, of course, here on Joy News, somewhere Wednesday or so, Evans Minster was started this whole conversation when, of course, we learnt of that statement from the society. So Joy News obviously is taking that lead in terms of the matters. We need to go, Dr. Hilda. Okay, so let me start off with Dr. Tinkrantwum. Just very briefly, the way forward. What's your thoughts on the way forward and what we should be considering immediately? Very briefly, sir.
All right, so what I'm saying is that the government should just make this the priority and stop. Will not inure to the benefit of the people of this country and provide the needed vaccines as urgently as possible for us to give it to our vulnerable children. That's what I want to say. Thank you for giving me the opportunity.
And I'm grateful too that you've been able to join us. For you, Dr. Anaba, briefly.
Thank you. I think this is what we call gross incompetence from the Ministry of Health and then facilitated by the government for ignoring the lives of our children who are born and going to work to pay the debts that we are accruing today, and that they should quickly look for the money and buy the vaccines to save our future years. Thank you.
Okay then, of course, Dr. Hilda, for you.
Yes, so what I'd like to say is that to the mothers and fathers at home, this is a good time to enforce the exclusive breastfeeding that we keep talking about, because breast milk offers some protection. Again, avoid overcrowding at this time. Don't take babies out if they don't have to be out, to help to protect them. Now, for everybody else listening, this is a good time to rally around and let's get the right things done for our children. We shouldn't politicize this. This is something that is big and affects everyone. It affects the future. And so we should do all our best to ensure that we have the vaccines. As for government, you know what to do.
Yeah.
Just get it done.
Get the vaccines. In fact, I'm adding my voice to that as well. And we'll keep monitoring the space. But thanks to Dr. Hilda, to Dr. Hadi, Dr. Thomas Anaba, Dr. David Tinkrantwum. They are all doctors. I'm sure by the next time we're having this conversation, I should be a doctor as well. But that's all we have for you here on the probe. We'll see you again. Thanks to our radio audience and for those of you who've monitored here on the Joy News channel. We'll see you again. Bye-bye for now.